Health Canada continues to cling to shoddy science to reject safety concerns around the bioaccumulation, biodistribution, and intergenerational repercussions associated with the novel COVID-19 mRNA injections. Health Canada continues to double down and assert the safety and efficacy of the novel COVID-19 mRNA injections, despite years of evidence showing that the precautionary principle has been thrown out the window. This time, I am bringing you a report and response to an inquiry from Conservative MP Colin Carey by way of an order paper question in the House of Commons. MP Carey asked about Health Canada's authorization of Pfizer, Moderna, and AstraZeneca's COVID-19 vaccines. He asked for information on vaccine components like the lipid nanoparticles, or LNPs, modified RNA, and how much of the subsequent spike protein people's bodies make after they've been injected with these materials. He asked if individual bodies vary in their production of spike, how long these components last in the body, something known as bioaccumulation, and where exactly they end up, which is called biodistribution. After all, we know from virologist and immunologist Dr. Byron Bridle and his work that lipid nanoparticles do in fact bioaccumulate and spread all throughout the body, something that we will get into in just a minute. Carey also asked if genotoxicity, reproductive and carcinogenicity, that's whether or not the shots have the potential to cause cancer, analysis were conducted and the details of each, including how long test animals and their offspring were followed post-injection and what kind of animal models were used. He specifically asks about the ACE2 receptor in said animal models, another thing that we will come back to after we dissect Health Canada's response, because I've taken the liberty to scrutinize their response. So grab a coffee, grab a seat as I try to make this as clear and succinct as possible. But unfortunately, if you're joining us on YouTube, they claim that this kind of deep dive goes against their purported community safety standards and compromises the safe and effective narrative. So if you'd like to see this full report, then please scroll down to the link below where you can find a link to access the full report, or go to nomoreshots.ca and scroll down to find the report there. Thank you, and I will see you on the uncensored side. The uncertainties around the safety and efficacy of these injections is exactly why we've launched a special campaign and website at nomoreshots.ca. There you can sign our petition if you would like to see these shots pulled from the market, and you can also send a form email to Federal Health Minister Mark Holland calling on him to revoke market authorization for these injections. All of that and more, and to support our work, please go to nomoreshots.ca.